Hi, I'm Dr. Silverberg, and I'm here today to talk to you about recurrent pregnancy loss, both the evaluation and treatment. Recurrent pregnancy loss is a devastating condition that affects a substantial percentage of the patients in our practice. We have two basic populations of patients. We have patients who can't get pregnant, and then we have patients who get pregnant, but then unfortunately they're unable to carry those babies to viability, and they lose those pregnancies. There's several steps involved in the basic evaluation of recurrent pregnancy loss, and these are all focused on trying to find the real cause of recurrent pregnancy loss. The most common cause is a genetic abnormality in the fetus itself. Okay, this does not mean there's a genetic abnormality in either of the parents. In fact, if a woman has miscarried 3 consecutive spontaneous times, and we know that every single one of those pregnancies was chromosomally abnormal, there's only a 2% chance that either her or her partner have a chromosomal abnormality. Nevertheless, because genetic issues are so common, we do want to evaluate, and so part of the evaluation, in fact, one of the first steps, is to check chromosomes on both the man and the woman. The second step is to evaluate the anatomy, the anatomic structure of the uterus. So we want to evaluate that either with a sonogram or a saline sonogram or a hysterosalpingogram, an HSG. Very important test. This is going to allow us to determine the shape of the uterine cavity. It should be basically a triangular shape to make sure that there's no developmental abnormality like a Müllerian anomaly, uterine septum, a bicornuate uterus, for example. We want to make sure that there are no structural abnormalities otherwise, like polyps, which is an overgrowth of uterine lining, or fibroid tumors, which is an overgrowth of tissue in the muscle wall of the uterus. Those things can adversely affect implantation. The next thing that we're going to do is we're going to evaluate blood tests to look at things called thrombophilias. Those are conditions that make it more likely to form a little microvascular blood clot in the small blood vessels in the placenta. And that blocks the baby's ability to get oxygen and nutrition from the mother, and it also blocks the baby's ability to send waste products back to the mother to get rid of. So the way that we do that is we draw blood, and we look for things like beta-2 glycoprotein, we look for lupus anticoagulant, we look for antiphospholipid antibody syndrome, basically by drawing anticardiolipin antibodies. We look for factor V Leiden deficiency, and we also look for basic hormonal deficiencies like hypothyroidism, and we evaluate a prolactin level. We then decide what is the problem, if the problem is definable, and we direct our treatment toward those abnormalities. So if the patient has a thrombophilia, if she's got a bleeding disorder, blood clotting disorder, we'll get her on treatment with blood thinners. Maybe as simple as baby aspirin once a day, maybe more complicated like Lovenox or more powerful blood thinner. If she has a structural abnormality in the uterus, we will take her to the operating room and correct that abnormality so that we can make her uterine cavity basically completely normal. If she has a genetic abnormality, then we'll determine what that abnormality is. She may have something called a balanced translocation, where a piece of one chromosome switches places with a piece of another chromosome. That can be treated in a variety of different ways. We can do in vitro fertilization with her own eggs, and then we can genetically test the embryos to determine which ones are normal and which ones are not normal. If it's her husband, her partner, same thing applies there. We can test him. And if in fact we have repetitive abnormalities there, we can use donor eggs or we can use donor sperm. If we determine no etiology, and this is the most common thing that we see with recurrent pregnancy loss, then we probably are going to recommend in vitro fertilization with pre-implantation genetic testing so that we can screen these embryos before we put them in and separate out those embryos that are chromosomally normal from those embryos that are chromosomally abnormal, and those are destined either to not implant or to miscarry. So the bottom line is there are a lot of effective treatments for recurrent pregnancy loss. It's a very treatable condition. The overwhelming majority of patients who come to see us with recurrent pregnancy loss are going to be able to successfully conceive and deliver a healthy baby.